Yes. We don't want to think that this is a challenger, though. So welcome, everyone. This is Ben Stephan. I'm the secretary is not able to attend today, so she's asked me to chair the meeting. We have a quorum. There are, in addition to me, Board Member Cranton, Board Member Rodriguez, Board Member Singh, Board Member Weckeser are all here, so we can do our business. We'll start with Cynthia. Do we have anyone signed up for public comment?
No, not today.
Okay, there is no public comment. Then Andy is filling in for Michelle, who's taking a well-earned vacation. So Dr. Ratner, please proceed.
I appreciate the promotion, Ben.
For the meeting only.
For the meeting only. Yes, I'll be giving the report in place of Michelle.
I'm just looking, looks good.
Question.
Mhm.
Do you have
Can everybody mute themselves, please?
Sharon, I think you're picking up your microphone. Okay, go ahead, Andy.
Okay. On the federal and state policy update side, since the board met last on May 3rd, the U.S. Department of Health and Human Services finalized a rule from the Biden administration that will expand access to healthcare for deferred action for childhood arrivals, DACA recipients. That will begin in the next plan year. And DACA recipients, those are young people who've come to this country as children, can apply for coverage through the marketplace and may qualify for financial assistance. On the state side, Governor Moore last week signed House Bill 728, sponsored by Delegate Bonnie Cullison, and Senate Bill 705, sponsored by Senators Antonio Hayes and Dr. Clarence Lamb, the Access to Care bill, which directed MHBE to seek a waiver from the federal government, as you know, and as the board had also affirmed last month, to let Maryland residents purchase individual private healthcare plans regardless of immigration status. We're going through that process now, and if ultimately approved, that will allow Marylanders, regardless of immigration status, to get coverage through the health exchange for the plan year 2026. No additional state resources will be needed for MHB to carry that out. And also on the policy side, there was just a report released today from Urban Institute titled State Variations in Medicaid and CHIP Unwinding for Children and Adults as of November 23rd. And I'm glad to report that Maryland was one of the 4 best states in the country in terms of carrying out the unwinding. That is, when the people disenrolled from Medicaid or CHIP came the closest to the projection that the state had made on how many would be disenrolled. So that was 4th best in the country. And I think it spoke to the professionalism with which the state, the Department of Health, MHBE, and other partners carried out that, the MCOs carried out that, delicate unwinding. So congratulations to everyone for that. In terms of staff updates, Trina Middleton, who formerly was with Maximus, joined MHBE as the Connector Entity Program Manager. She will replace Ginny Seiler, who was an original employee of MHBE and a 29-year state employee. So congratulations to Ginny on her retirement, and welcome, Trina. We're very happy to have you. And I believe you also are aware that the board retreat, originally scheduled for June 17th, has been moved to Monday, September 16th, since the board, may not have replaced its 2 vacancies by next month, as far as we can tell. And lastly, I'll leave you with some updates on data, which I think you'll be interested to hear. This is according to data from the Maryland Health Exchange's HBX system. So private plan enrollments at the end of April were up 26% over the prior April. But more interesting than that, it was the first time in the history of the Maryland Health Exchange, after a decade, that enrollments in April were higher than they were at the end of open enrollment in January. That had never happened before, and it had never happened even in 2021, when because of the pandemic, we kept the exchange open more than an entire year. I think it speaks to the importance people regard health insurance now, the fact that some people on Medicaid who realized they had it and may have lost it because they were no longer eligible, realized it was something they still wanted. The operations that we've done in terms of getting premiums lower and enhancing and the changes at the federal level to enhance tax credits, the technological changes, the consumer assistance changes that we've made to make it easier for people to navigate the health exchange. So the fact that we were higher in April than in January really was phenomenal. Also, there was a time years ago when it said that, oh, the exchange, you're good at renewing people, but you're not that good at bringing in new people. New enrollees at the end of April totaled more than 10,000 people. That was up 164% over the prior April. And also a record for the state marketplace. 29% of all enrollees at the end of April were new to the exchange. Again, changing the story from we're just good at renewing the existing customers to we're not as good at bringing new customers. We certainly are good now at bringing new customers. Montgomery County led the way with more than 2,000 new enrollees during April. Prince George's, Baltimore City, and Baltimore County each had more than 1,000 new enrollees in April alone. In terms of health equity, enrollments by Hispanic Marylanders grew 41% in April year over year, and enrollments by Black Marylanders grew 19% year over year. And lastly, the importance of bringing young people into the marketplace. Young adult enrollments were up 68% in April year over year. More than 75,000 young adults who were enrolled at the end of April, about 55,000 qualified for the state subsidy that averages about $38 a month to help further lower the costs of young adults who are enrolling in Maryland Health Exchange. So those were all great numbers. MHBE, the National Association of State Health Policy think tank out of Washington, also just released some data on the state exchanges. And Maryland was only one of 3 state-based exchanges since 2021 who have quadrupled enrollment by enrollees with access to coverage for less than $1 a month. Only Connecticut and New York had done that. So that speaks to the affordability piece of Maryland Health Connection. Maryland was one of only 7 state-based exchanges whose enrollment grew by 25% or more for individuals making from $15,000 to $30,000 a year, again, speaking to affordability. And lastly, Maryland was one of only 7 state-based exchanges whose enrollment grew by 25% for both children under 18 and for young adults 18 to 27. So again, as a state, as an exchange, we're doing something right to be at the tops of these lists regarding affordability, regarding young people, regarding operability and growth. So I thought you would be interested in all those statistics. Do you have any questions for me?
Thank you, Andy. Great presentation. Do you have information on what the average premium was for individuals coming off Medicaid and enrolling in private coverage through the exchange? That would probably be not a number you have, in your back pocket, but I'm curious if you could get it for us. I think that would be, interesting when you say $1 or less. My assumption is that most of the people that came off of Medicaid would be looking at very, very low premiums through a qualified health plan.
Yeah, we can try to isolate that figure for you, Ben. As you know, Maryland has among some of the lowest premiums in the country. And I think I saw a report last week that Maryland had the lowest premium in all health insurance. So we're talking about, other, small group, large group overall of any state in the nation. So, but we will look to isolate the figure that you're seeking on the Medicaid unwinding population.
Other questions? Seeing none, We'll now turn to the,
And can I interrupt? I think we need to approve the minutes from April.
yes, we do. Before we do that, I want to note that Board Member Allen and Board Member Bahrain have left the board. Did we send a proclamation or something to honor their service? Andy, do you know?
I'll have to speak with Michelle about that because we weren't quite sure of their attendance at what was going to be a June retreat. So we'll have to circle back on that as well.
And I'm sure we all thank them for their participation and attention to all the work of the board over the last 4 or 5 years. And what Andy was saying earlier was that the governor has not yet announced the 2 new replacements, but when he does that, I'm sure that will be shared with the board. Let's turn now to approval of the minutes. Give you a chance to, if you haven't looked at it, pull them up. There are extensive minutes. Do we have a motion to approve the minutes?
So moved.
Any questions for staff? A second.
Second,
You have all those in favor?
aye.
Aye.
You could just raise your hands like we did. That would be helpful real quick. Since there's not many of you, I can get it done quick. All right, we're good.
You have 5 votes in, yeah. Let's move to the board committee updates. We'll start with Dana.
All right. Okay, can you hear me?
Yes,
Okay, good. Yes, the committee at the time of 1 board member, because the other 2 have since left. They did a great job. But the staff went ahead and presented their draft agenda, and we had discussions anyhow. Michelle presented the draft agenda for the board retreat. And the agenda essentially was at the time welcoming remarks and warm-up session where we're led into an interactive activity. It's kind of redundant. After that, most of the board meeting in the morning will be taken up by board governance and training and a discussion with a panel on Maryland Health Connection for small business. Once we settle into our lunch, there will be a guest speaker, and I don't know if they have since come up with one, but at the time it was to be determined. The afternoon will be largely made up of board planning, looking at funding stream for MHBE, 2025 legislation session, unified eligibility, etc. And the meeting will conclude with a wrap-up of the day and next minutes. I gave my feedback and I thought the agenda was fine. Next, the MHBE policy team presented small business regulation updates, and Amelia Marcus presented the let's see. Yes, she provided that presentation. And the updates there were on the minimum participation rate for the employee choice model and the waiting period for employee coverage. And that eventually, I'm sure, will be shared with the board. Next on the agenda was a discussion on the planned work groups coming up of stakeholders. And at the time of the committee meeting, both MHB was recruiting for both work groups, and they expect to be launched early this summer. Ms. Marcus remarked on the value plan work group, whose purpose is to evaluate 2024 value plan to inform future plans, particularly next year's, and to design next year's value plan, focusing on standardized cost sharing, pre-deductible coverage, cost sharing for health equity across conditions such as diabetes and other conditions. Next, Ms. Becca Lane presented on the Consumer Decision Support Work Group, whose purpose is to discuss areas to improve support for consumer decision-making while they're shopping in the individual market, with a focus on the Get an Estimate planning tool and within the MHC application. Also, the work group will be asked to develop recommendations to better help consumers with selecting health plans for consideration based on their own individual health and financial situations. And the next meeting is scheduled for Monday, August 5th.
Thank you, Board Member Wekesser. Any questions? So we also had a Finance and Audit Committee meeting. Board Member Crandon and I attended that. We had 3 agenda items. We had a presentation from the from Tony on the finances of the board, as well as the IDIQ RFP approval process. We had a update from Scott Brennan on the OLA audit, and we also had an update from Sakiat Atta on the privacy issues. I'll circle back to Tony's presentation. I think that was the bulk of the discussion. The reality is that we have about a $1.4 million deficiency that had been recognized and planned for, and DBM had initially provided assurances that that could be met through transfers from elsewhere in the state budget. But with the collapse of the Key Bridge, DBM has backed off of that commitment, and the board is looking for other options. It does appear that the state has requested less than it is entitled to for the work related to unwinding. And although the deficiency has not yet been resolved, the staff did convey to the board members that they were pretty confident that it would be resolved before the end of the fiscal year, which is ends on June 30th, 2024. I'm sure we'll hear more of that as we move forward. Scott's presentation focused on the continuing work of the Office of the Legislative Auditors. He did note that there probably would be several audit findings related to eligibility, some inadvertent releasing of patient data related to enrollment that does happen occasionally, but was confident that the OLA audit would be concluding over the next 3 to 4 months. And lastly, on the privacy report, we did hear again a commitment on the part of the staff to continue efforts to protect consumer information. Ms. Atta went through some of the training that employees go through. We did talk about the ongoing data breach at Change Healthcare. There was a question about whether that had any impact on the exchange, for example, having to disconnect, and whether there was any liability that the exchange could incur as a result of the breach. In subsequent communication, the view was that the board did not have any exposure as a result of the data breach at Change Healthcare. Board Member Crandon, did I miss anything?
No.
Okay,
That's everything.
any questions?
Question, sorry I missed the meeting. We had a unannounced DOH survey. That happens to the hospitals sometimes. Everything went well. So I missed the meeting. Thank you, Ben, for giving the report, and thank you for helping chair that meeting. One question I have is in relation to the 1.5 million that we are saying that we may have a shortfall. With June 30th only about 6 weeks away, do we know which direction to look for to balance that out? I know I heard that it may be okay, but which direction are we looking at to balance that out?
Uh,
You want me to go ahead and answer?
Tony, why don't you, go ahead?
Sure. Thank you, Ben. For Chairman, acting chairperson. Yes, Board Singh. We are looking, we have three routes to go, and the main route we're going to go is fulfillment. During the PHE unwind, fulfillment for printing notices, it was 75%. And all along, we had always been recouping 50% from the federal government. So we're going to go back and recoup that extra 25%. Not only is it an extra 75%, but the amount that we technically we recoup right now, it's a 50-50. So basically, not getting too technical here, we're recouping 44% right now. So in going back and recouping additional funds, it's an extra 31%. So that right there alone should get us to where we want. Finishing up the information, I'm going to ask MDH today or tomorrow how they would want us to submit it to go back and recoup additional funds, and that's going to probably cover the whole balance. We got two other possibilities. One of the possibilities was for software. We could allocate software or amortize software basically on a monthly basis, and that would reduce our software costs for FY24. If we needed that, it doesn't look like we're going to need to do that. So we discussed it last week, and it looks like we'll be okay as far as that goes. So the third method is for call center. Those calls that have to do with PHE unwind, again, in the as needed APDs, we requested 75% of the calls to be reimbursed. But in the past, it was difficult to break out, but we found a way that we could go back and recoup 75% rather than probably 60%. So the main avenues we're looking at right now, and we'll know pretty much this week, next week, is the fulfillment, which the fulfillment alone should cover that, and then additional call center funds, recouping funds at a full 75%. So that's the route we're taking.
So it looks like you're comfortable in our approach that one or multiple of those avenues will result in helping us balance the budget.
Yes, sir.
So the next question I have is that this bridge situation and the impact that's having on the entire state's budget. And I know some of that will be, or most of that will be federally funded. At least that's what the media is saying. And we had at the last meeting discussed that the fiscal 25 budget was reasonable for us, tight but reasonable. Are we anticipating any impact of this on fiscal 25 budget that we are aware of?
No, sir, not right now. One of the benefits of going back and reallocating this fulfillment is that a portion of fulfillment, which is a pretty large portion of it, we can recoup at 75%. So in our budget, we're only recouping at it at 44% in the budget. But in actuality, we're going to recoup a large part of that at 66%. So that we should be okay next year, to be honest with you, because of that.
Thank you. The second question I have is the OLA audit. It looks like if it's another 3 to 4 months, it looks like it's taking about a year more than what we had originally anticipated. That's long time. And I understand, there are always some challenges that happen, when these audits are conducted, especially when they're conducted after multiple years, which is the standard process. Should there be an interim meeting with the auditors, which most organizations have, for an interim report of the findings thus far?
I'm not aware of OLA requesting that. It would be, I think, unusual for the entity subject to it without some questions. The Healthcare Commission's audit did take a considerably longer than in previous years. I think it may be related to staffing rather than any sort of extraordinary finding that we should expect to be presented to the MHBE at some later date. I don't know if Scott has anything to comment on or not, but my understanding was there would be some findings, but nothing. I don't want to say any finding is not consequential, but anything unexpected. Go ahead, Scott.
Yes, thank you, Board Member Stefan and Board Member Tanay. I can address this. I think that at this point, I believe that, and I know I've said this in the past, it's hard to tell exactly when OLA is going to wrap up with their examination. The pace at which they're examining our system data has decreased, and it appears that they are coming to a conclusion. 3 to 4 months, at this point is an estimate. I think it could be as soon as in the next month, just based on the cadence again of their requests and our submissions to them. So I agree that it is taking a long time, but considering we did reach out to OLA and ask if we could expect their findings to be prepared in time for our last Audit and Finance Committee. They indicated that they could do a partial submission, and we didn't want to press them to do a partial submission just for the sake of having it ready for our quarterly meeting. So we indicated to them to take their time and submit the full report to us. So we do expect that soon. As for the 3 or 4 month time frame, I think that's somewhat of a guessing game. I think it could come sooner, but we just really don't have any real credible idea because it is entirely up to them. So hopefully that helps address your question. But I agree, we are approaching a year. The end of next month will be a year.
Great, thank you, Scott.
You're welcome.
Thank you, Chair.
Any other questions? Seeing none, I think the next agenda item is from Venkat. He's going to provide an IT roadmap update. So I think he has a presentation, so we can pull up the slides.
Good afternoon, Vice Chair, members of the board. So back in January, I provided an IT roadmap presentation to update the board on what we think that would come for this year. I will recap a little bit and then explain to the board what we have done so far and in this first quarter of this calendar year, January, February, and March, and then what is in store for us in April, May, and June. And then I will open for any questions. So this is a quick recap. When we talk about exchange technology in a nutshell, we talk about the web applications, the consumer portal, worker portal, broker portal, marketing portal, and presumptive eligibility portals. And we have a shop platform. We have a MarylandHBE.com stakeholder site as well. And as the board knows, the consumer portal is our key gateway for our consumers to connect to the exchange and seeking coverage and getting benefits. And worker portal is for our MDH and DHS staff and for the call center team to provide support and others to provide support to the consumers. And broker portal is a portal where we connect the brokers with the exchange. In our recent implementations, we have a product called Broker Connect tool, which connects the broker and the exchange and the consumers through web technology, as well as mobile application, as well as the texting functionalities, which we found that one of the successful products. And marketing portal is where our marketing team reaches out to consumers to perform certain outreach activities and track certain metrics as well. And the presumptive eligibility portals is recent ones. The one I would talk about, the hospital presumptive eligibility portal, which is implemented last month, is another Medicaid request to the exchange to bring more efficiency to our Medicaid consumers, specifically the newborn ones who go through the hospitals for eligibility coverage. And we kind of integrated that with the HPX and the MMIS system. And that's about a very high level about the web applications. But about the mobile app, ours is, as the board knows, is a very successful mobile application. We have end-to-end. Consumers can seek coverage, manage their accounts, and manage their coverage, etc. And our traffic, consumer traffic, is more than 65% going through our mobile technology. And over the years, we've done several modifications, enhancements, user experience improvements, and we have our mobile app on both iOS and Android platform. On top of it, we have something called React Native platform, where our technology team works on that platform to disseminate the code to both the platforms so that we eliminate actually the redundancy of writing codes for two separate platforms. We implemented that last year, and we find that very successful as well. And the CRM is an important application as well. That is our call center score technology for any time when a call center staff gets a call, a ticket is logged, and we had logged more than 8 million consumer inquiries since 2017. And we continue to integrate the Salesforce system, the call center system, with the HBX system, and also with certain carrier applications as well. And we also have a small homegrown applications in Salesforce to perform our work management functions as well. And the newer addition is obviously the enterprise automation. A couple of years back, we implemented a robotic process automation tool. And thanks to the Department of Health team for working with us very closely. And currently, we are able to verify more than 100,000 consumer documents for income through the bot automatically. Otherwise, this would go through a manual process on extended wait period and go through the workers to verify the income finding these documents. And AI bot fluoride, we're putting AI very cautiously. I just wanted to insist that we are not mindlessly going into AI. Our chatbot, what we call Flora, has been a very successful tool for quite some time. However, over the years, we found that the quality of the responses, the complexity of the questions the consumers pose are not able to be handled by this bot. And thanks to the technology we have right now, we cautiously stepped into this, integrating our chatbot with the so-called GPT technology, where a consumer's queries can be easily interpretable, and also the bot can comprehend the questions more closely and respond more accurately in terms of natural language processing. We took enormous caution to ensure that this technology, when we implemented, does not seek any data of consumers and always uses the knowledge base that the exchange gives to respond to the consumer queries. We also shared our AI strategy with the Department of Information Technology and the leadership of the state on AI implementations. And very thankful for their blessings on these placing these tools as well. We also shared the information with the CMS as well. And so far, the number of responses are significant. And a version of this bot, which is called Live Agent Chat, which connects the consumers with a live agent at the call center. That's a very successful tool for our consumer as well. As you can see, the numbers within a couple of years, it's more than 250,000 live chats that have been catered to as well. And we handle enormous volume of accounts. And as Andy talked about earlier, with more and more enrollment coming to the exchange phase, the more data and the more responsibility and complexity comes to the exchange technology as well. And we manage all these technology functions within the IT functions, from PMO to development to testing to security functions. The one function that I have not shown here is the MD Think platform managed by the Department of Human Services, where majority of our core systems lie on. So next slide, please. So this is again a quick recap on the strategy for 2024, cybersecurity, innovation, collaboration, and operations. I made some tick marks in some of the items where we are either making progress or we have achieved substantial progress in some of these items as well. With respect to cybersecurity, our focus is on building a disaster recovery and business continuity option for the exchange. We are working very closely with the MD Think team. And recently, we are, I think, at the process of signing on MOU with MD Think team to help us migrate certain lower environments to the exchange and also build a disaster recovery option for the exchange. And in terms of awareness and training for technology, we are focusing more on providing the awareness to our agency staff in terms of artificial intelligence technologies. For all our security practices now have an AI component in terms of training. This is across business and technology as well. Also, internally at senior leadership level, including policy, operations, and compliance. And we are drafting an AI policy for the exchange for the long run. And we will be circulating that policy for external vetting from Gartner, as well as we will be sending it to Do It for further review before we adopt that as well. So we just wanted to say that we are making some progress in that area as well. And in terms of innovation, we expand our RPA capabilities to validate certain other documents that Medicaid team currently manually verifies to provide eligibility for certain type of consumers. We are expanding that in subsequent slide. I'll talk about it briefly. And we also expanded our consumer engagement channel, a channel called Secure Messaging Option, where consumer can send a secure message through the consumer portal to the exchange. We have recently slightly expanded that to receive certain type of technical requests that system can automatically take care of. And down the line, we hope to expand the channel further to connect consumers with our operations special projects team or more. And we also currently, thanks to the board for approving the Databricks software a few months back, and we are beginning process of setting up a data analytics platform at this time. And we have completed a couple of proof of concepts, and now we are in the process of extracting data from various sources, like our consumer portal, HBX, our call center, and our web traffic information to store it in this particular platform that will be eventually built as a data analytics platform for us to inform more about consumer behavior and policy response and impact in terms of enrollment, etc. And in the next quarter, I will provide some update about microservices architecture. We haven't done any work at this yet. We are looking to build the platform in the next generation capability of dissecting the large monolithic application into multiple compartmentalized applications. That would be the architecture of the future, or currently used in many private organizations as well. And that would put a stability for the exchange technology for several years to come. And in terms of collaboration, we work very tightly with the Medicaid, and also we have implemented some real-time enrollment with our carriers, and even simple functionalities like pay now option for certain carriers really bring the more dividend to carriers in terms of faster consumers sign on, and for the consumers in terms of faster response from the carriers as well. And last but not the least, operations is key for the exchange. And we are again working closely with the MD Think team to migrate several lower tier environments to MHBE. And thanks to the board subcommittee for approving the 4 new positions that we requested to facilitate this project as well. And we continue to implement policy changes and system enhancements as well. Next slide, please. So this is a quick update on the Q1, meaning calendar year Q1, January, February, March 24. The 3 projects on above the timeline, Chatbot Flora, Newborn Portal, and Broker Connect and mobile app, are coming under what we call a special projects, which operate slightly differently in terms of project execution, focusing on more on innovation and newer technology and delivering value that can be tied to the technology. The Chatbot Flora, as I noted earlier, we have enhanced conversational capabilities for consumers who already logged in. So for example, when a consumer is already on the consumer portal, they have a question about a certain function on how to enter information, or a specific question about their plan that they want to choose, they can immediately connect right there from there to the agent, or they can ask a generic question as well. And we do see significant traffic flowing through this workflow as well. And as I noted earlier, Newborn Portal is for the portal for hospitals to apply Medicaid eligibility for deemed newborn. Currently, this had been a pain point for Medicaid, where there are a lot of manual processes are carried out. And after implementation, we have seen 148 hospitals onboarded by Medicaid. And also we have seen more than 200 newborns enrolled since April, since the middle of April. And the third one is the Broker Connect and mobile app. We built last year, end of last year, we built a mobile app for the brokers, which is an extension of our current mobile app with the same branding. And we provided more options now, enabling a Broker Connect tool that connect the broker with the consumer, with the exchange through the mobile application and the web platform. Again, this is one of the popular options for the brokers as well. And below the timeline, I listed out several initiatives. Some of them are our usual process, such as 1095 A and B processes. Operationally, we carried out, which is developing 175,000 plus 1095As, or more than 1.2 million 1095Bs post December. And we had done several policy enhancements to the system. And the usual security updates we continue to do as well. And with respect to the robotic process automation to verify Social Security number for eligibility, normally we verify Social Security number through the federal hub, which connects to the Social Security Administration, and we electronically verify the Social Security number. But there are occasions where consumers either don't have SSN at the time, or they are required to submit a paper proof, and these process goes through a manual verification, which takes a longer period of time. And thanks to Medicaid MDH for supporting us, and we have developed a solution that is in the last 1 month of piloting, we found that it had 100% accuracy, and we are thankful for Medicaid for adopting this technology in the near future. Next slide, please. Thank you. And so this is a quick update again on what we plan to do April, May, and June at a very high level. And we continue to focus on implementing more Medicaid policy changes geared towards providing continuous coverage for children and more security enhancements and the technology enhancements for our knowledge base. And we are also bringing a content-specific help for consumers. When a consumer, for instance, they are in a consumer portal, they have a question of a specific field. For example, what is your MHBE income? That's a very, very difficult question for even a learned person in this field to answer. And that's why we see most of our consumers drop out of the workflow and call the call center. So we are monitoring the consumer traffic across our workflow and picked a couple of points at this time. We will expand it down the line to see where we can provide help to consumers in those points. And in those points, our intent is to provide an option for consumer to click a small icon that can, within the window, open in a natural language and what this particular data element means. And also give a small snippet of a video. When they push it, they can see how that information can be entered. So we hope this would reduce our call to the call center even further, hopefully. And based on this proof of concept, we will see if we can expand it further or not. I will keep the board posted on this as well. And June onwards, we have a larger technology upgrades coming along our way. This is a kind of a cyclical after a few years. We start with upgrading our workflow manager, and by July, August, we will touching our database and the content management systems. And after open enrollment, we will further upgrade certain other technology key components in security as well. So I will stop here and pause here and for any questions.
Thank you, Venkat. A question for you, actually two. You mentioned that DoIT was planning to release a policy. Are they approving our AI applications currently, or is there any review process? I know California, Colorado, and a couple other states have released AI policies. Anything that you can tell us about the state?
Sure, Mr. Stephan. Yeah. I'm sorry, please go ahead.
Go ahead. That's just anything. What's the process? Can you develop an AI application? Does it have to be approved by DoIT or anyone else in state government? Any information you can share with us?
Sure, Mr. Stephan. I would think that would be ultimately that would be the direction for the state, even though whether it may cover executive agencies or not, or all other agencies, I would think that would be in the best interest of the state, in fact, to ensure any technology that is AI-related technology adopted follows through certain ethical guidelines or certain guardrails that all the agencies should follow. And right now, we do not have any official policy, even though we understand that DoIT is working in the directions. And we do have president's executive order and a similar order from the governor as well. And we are also developing a policy that we will be vetting with DoIT. And anything DoIT and other organizations that would find as a best practices, we will be incorporating them in terms of policy. And in terms of internally also, we started early on, and within the agency, we looked in all our senior leadership team to contribute and participate as well, including our Attorney General's office as well. So we are very confident that the direction we will move will be a cautious step into adopting these technologies. But at the same time, we don't obviously want to miss out on the advantages of these technologies as well. So as the next steps for this year, right now, we are not looking at any consumer data, not even aggregated data. When I say aggregated data, meaning we are not even looking at data, for instance, enrollment data consolidated for a specific area. We are not even looking at that, even though those aggregations would come as a significant advantage down the line. But at this time, we are not looking at it. All we are looking at right now is to utilize the natural language capability of comprehending consumer queries and responding to consumer queries outside of consumer data. And the knowledge that the bot would come from the exchange only. We are closing the bot to seek any information outside of what the exchange feeds. So, and that knowledge base comes from our website and publicly already disseminated information, as well as information that would be vetted by our marketing and other policy teams. So at this time, we are very cautious on touching the consumer side of data. As for internal applications, we are working on considering certain tools that may be, for example, if we have an internal bot for our staff, if you want to question, if you have any question on what type of policy we have, for example, for the agency in certain specific function, the bot can immediately go into our policy documents and elicit that information, provide that information to the internal staff. The same can be expanded to set of requirements we have implemented over the last 10 years, for example. What are the system fixes implemented for Medicaid touching M-CHIP, for example? And that would give all the information. So these are all wonderful efficiency enhancing tools. But again, we are very cautious in those areas. We are still working on looking into these technologies and considering these technologies, but we haven't moved beyond what I just stated. And we are also closely working with Do It in terms of providing an update to Do It if we are going in any of these directions, seeking guidance as well.
Thank you. Just during your presentation, you mentioned that enrollees were dropping through to the call center. Do you monitor the percentage of individuals either enrolling or renewing that do it without human intervention? Do you keep that as a running target or running total? Strikes me as maybe it's a managing for results threshold that's easy to capture, perhaps. But do you maintain that statistic on a month-to-month basis?
I wish to say that yes, but unfortunately, no, Mr. Stefan, but we are in that exact direction that you pointed out. And in fact, once we got the data bricks, that's exactly what we are doing right now to feed a lot of these data at one place where we can infer. One of the initiatives that our policy director, Johanna, was also talking about is to show us some examples from other exchange, what's performed as a slug audit, where efficiency can be built in. So we will be looking at that closely as well. Right now, what we are doing is putting in data parameters across the consumer flow where we can collect those data. So we are at the very early stages, but I think we are very confident by the end of the year, we should have a very, very good overview of where our consumers are potentially dropping out or needing help. At this time, we found in a couple of pages, for example, income pages, which is a very key page, building a household, and at point of the eligibility submission and point of plan shopping. These are some 4 major areas we found at the time consumers seem to be struggling, because when we look at the traffic, we see a significant drop after that. So we have some information definitely in terms of traffic flow, but making it more automatic in terms of like a dashboard type solution or some sort of building a trigger that can allow the team to focus on. That is not there yet, but that's our aspirational goal.
Thank you. Other questions? Okay, seeing no questions. Thank you, Venkat.
Thank you, Mr. Chairman.
We do have an action item, the IDIQ master contract, second base year task order with a not to exceed amount. That's Sherelle and Venkat.
Yes, good afternoon.
Go ahead, Ms. Green.
Good afternoon, everyone. I'm sorry, IDIQ contract review. As you know, we're submitting our FY 25 budget. IT consultant and technical support services are procured through a streamlined, competitive, and cost-effective procurement process, utilizing the indefinite delivery and definite quality IDIQ master contract. Contract highlights are stated below. In April of 2023, 110 master vendors were approved for providing services under the IDIQ master contract for 5 years, from January 1st, 2023 to June 30th, 2028, under specific functional areas and labor categories. The task orders are awarded for a base period of 3 years with 2 one-year option extensions. For the base period 1, FY24, MHBE board approved the award of 115 task orders on April 17th, 2023, and an additional 40 task orders on May 15th, 2023. MHBE Finance Audit Subcommittee approved 4 additional task orders on May 3rd, 2024. MHBE has reduced 1 contract position in FY24. Currently, we have a total of 158 open task orders. Next screen, Cynthia, I'm sorry. Here are a list of our functional areas, and we actually broke them down by the number of resources that are currently in those areas. Okay, next screen. Here are some of the IT functions that help us with the IDIQ positions that we have available and all the enhancements and tools that we use to get the job done on a daily basis. Next screen. This is the IDIQ budget comparison from FY24 to FY25. MHBE requests the board to approve a total not to exceed amount of $35,475,000 with the federal financial participation amount of $25,687,200 and state participation amount of $9,787,800 for the IT IDIQ contracts for fiscal year 2025, subject to the availability of federal and state funds. Any questions?
I have a couple of questions.
Go ahead.
Hassan, how are you?
Good, good. The first question I have is when we, and again, I'm sorry I missed the last Audit and Finance Committee meeting. The task orders that were approved, which I supported the last meeting or before the last meeting, my understanding is they were for short-term engagements, and if they were for short-term engagements, why are we asked to approve a 5-year commitment or even 3-year plus 2 option years on a short-term engagement? That was one. Number two, we were also advised that now that we will be adding 7 managers on payroll in the 25 budget, that should help us in some ways. And the third is that we were also advised that there'll be other enhancements which will result in relieving some other IDIQ workers. So with those 3 factors, I'm not seeing the impact of that in this request for board to approve.
Ken, do you want to address that?
Yeah, I will address the technology side, Cheryl, and Tony, I will talk about the contract duration. Maybe you can correct me if I'm wrong. So, Mr. Singh, the contract task order is structured as 3 base period, as you know, and 2 one-year optional extensions, and with the option for the exchange to terminate the task order at convenience. So that's the structure. Maybe I'll pause here and request Tony or Cheryl to update why the structure is there before moving on to the next couple of questions.
That is correct, but I think his question went more towards, I'm not sure, Sang, were you talking about the 4 new positions that we had and we justified them by stating that they would be for a short period of time? And so
That is
therefore, why are they being considered for maybe the whole year for FY25 and moving forward?
That's correct.
Okay, so Van Kate, you can address the need for having those additional 4, or what's your definition of short term was considered to be?
Well, that's what Tony had, in the justification we received. And I think the board member Crandon and I had the same question. If these are temporary, how long they will be there, and then will there be enough budget and so on. And my question goes a little bit beyond that. Yes, well, how long is the temporary? To me, temporary was few months, and then, but that was never defined, and I did ask subsequently to keep the board posted, as these temporary engagements come to end or other savings get achieved. So I'm not here, it's the request for the full year, which does not show either the temporary nature of the approvals, and also it does not show what other savings will be achieving with other, other efforts that were provided to us in the justifications for the Finance and Audit Committee members.
I will address on the technology side, Mr. Singh. I'll let the contract structure to our CFO. So as I understand, this is a temporary position with for the agency to exercise its option, especially in the option years with the approval from the board. But as to the structure of why the task order is not issued only for 3 months, as I have seen in the last 7-8 years, the procurement practice had been to issue for the base year plus optional extension with board's subsequent approval. So that's on the structure of the contract task order. But as for the need for it, as we noted in our request, these positions are required to perform our lower environment migration from MD Think environment to MHBE environment. And this is our longer term consolidation effort of handling our lower environments internally. And we presented to the board and also requested CMS for their approval through our IAPD. And so as part of that, we have been working on it. And unfortunately, there was a large time gap between when we wanted to get started and when the MOU between us and DHS happened, which is still, as I understand, is almost at the final stage right now. So we tentatively agreed on what we should be doing in terms of how many environments we would take over and what would be the process of migrating to the exchange and what would be the post migration support requirement that if we ever need from MD Think, or what would be the responsibilities post migration, etc. So this task obviously took much beyond than what we originally expected. We recently started that, and that's the reason we had to delay those 4 positions until we were almost sure that we are going in that direction. That happened only last month, and that's the reason for timing. In terms of savings, there are 2 parts to it. I think our CFO Tony also talked about it in his response a little bit. The one is the cost saving part. By doing this, what do you save for the state? We highlighted some potential cost savings. For instance, currently we believe we are overpaying for our services to a tune of 20 to 30% in professional support services, and also in terms of managing our day-to-day releases. So that is the bulk of, in my view, the cost savings. And beyond including the cost savings, this is the direction for the exchange to consolidate several of its core functions, including the system operation, DevOps, and deployment processes internally within the exchange to adopt to newer technologies. That's the larger goal for us. And to answer your other question on the middle level manager positions, These positions are non-existent currently. I can't quantify exactly how much we would be able to save because of having the state positions. But these positions are placed at the key functional area. For instance, as the security manager or as a system operations manager or EDI manager. These positions are currently not there. So it is our strategy to have a certain state position in these areas for the longer term stability of the exchange. And I'm pretty sure that we will save some cost in terms of eliminating some IDIQ positions that may overlap. But as you had pointed, at the time of that, I'll be sure to come back to the board and present those cost saving we achieved as well.
Dana,
Yes, I have a question. I'm assuming that you all considered all scenarios, but I need to know, or I think the board would like to know, if you have a plan B, should federal and state funds be greatly reduced, especially given paying for the Key Bridge collapse? And I'd rather have more than a yes and no or no answer, but could you expound on plan B or C or whatever? Thank you.
Thank you, Dana. Appreciate it. And in terms of, there are two things with respect to federal funding. Through our implementation planning, advanced planning document that we submit to CMS every July for seeking funding, we provide a detailed plan for task what technology would undertake for the whole federal fiscal year. And we categorize it in 4 categories. One, eligibility and enrollment related policy changes. So anything that touches Medicaid eligibility enrollment. Then we talk about special projects, like I talked about, some of the innovative technology options that we bring in that would eventually benefit the consumers. And the third, we talk about integrations, how our system can integrate with other state systems within the state and the federal system so that we can bring in more efficiency. And the last one is what we do for technology in terms of upgrading, improving security, bringing new tools, etc. So we list that, and we also give a detailed schedule to CMS, and almost on a monthly basis, we say this will go on this month and this will go on this month. And we also provide a monthly update to the CMS on where we stand on every of these initiatives. And of course, that may not happen 100% time in practical situations sometimes. And last year we had a PHE, public health emergency unwinding, and the year before, a couple of years for COVID. So during those scenarios or any priority changes, even within Medicaid, we had to take on newer initiatives which were never mentioned in the IAPD. However, in the subsequent years IAPD, for example, this year's IAPD, we will have to show what all the initiatives that we potentially should have done but missed, and what all the initiatives we took over instead of we never mentioned it before. And CMS evaluates that closely. And so far, all these years, we have not received any negative comment in any way. We have been always proving the money is worth in some ways to implement those options that we asked CMS. That's from the federal point of view. From the state point of view, that's a great point. If, for example, we have been approved state funding for fiscal year 2025 for IT, which is slightly, probably more than we may need, slightly more. But what if it is cut? That is the larger question. If we get cut, the one way we can, there is a slight room for within IT to switch resources or terminate certain contracts or reduce the hours for certain staff that were not on the high priority task and things like that. We haven't gone through that yet in a very serious way all this time. But those are the only options. And then I would defer to our CFO for any other thing that you may see in his role, definitely.
Tony, do you want to respond?
Yeah. So one thing I was going to say to clarify, Van Canton, reiterate, the savings from the four, once we move the lower environments off of MD Think over to us, over to our AWS platform. Right now they have professional services that are working on our system, including the lower environment. So once we move those lower environments over to us, like Venkat said, it's about $120,000 to $150,000 per month for professional services over there. Those savings from those four individuals, once it's up and running, will show. And I guess really we can, but I think originally, Venkat, you were talking about them showing later in this calendar year. That I don't know how long it's going to take to transfer the lower environments, but there should be an immediate drop in professional services from MD Think. What kind of time frame? I think you originally talked about the late fall. Is that right?
That's correct, Tony. And also we are in our recent conversation with MD Think, we would like to retire some of those environments sooner than waiting until the end of the year when we migrated everything. So we changed our methodology a little differently, and we talked to MD Think. For instance, when we have our development environment, one user acceptance testing environment migrated, we can establish a path to migrate our production through our environments, and therefore we can retire those two environments. So we will be going in an agile iterative process on this throughout the next several months until the end of the year.
And I guess that should show itself when you get the board report for MD Think resources. They should drop, and certainly we can. I can break that out in the narrative when I send that out for the board report next year to show the savings and the decrease of the professional services provided to us from MD Think.
That's all good and informative. Did you all consider that for the NTE as if the savings would not happen? Or did you consider that the cost saving when you came up with the NTE? In other words, I think I heard just plan A, but I'm not sure there was a plan B should the amount of federal and state funds.
Well, for right now, I mean, the NTE is the NTE itself, and the way IT does it is if you take all the NTEs, that's greater than our budget. But what happens is all the resources are not going to use up their NTE. So, for instance, an NTE might be 2,000 hours, and when Venkat and IT is putting together the number of hours that are going to be required by each task order, he has to stay underneath the budgeted amount. The FEMA system will not allow him, because we set up a blanket purchase order, it will not allow him to go over the budgeted amount. So that's the check and balance there. The federal government, we're working on our APDs now, and those will be submitted within the next couple of weeks. That's for the federal portion. I can't imagine the federal portion having an issue. I guess a possibility, which I've never seen this happen before. Of course, I've only been with the state for 16 years, or 13 years, I'm sorry, is the possibility of a budget cut in the event that things, right now, our budget's passed with the state. So the funds that we're going to have are going to be within the state budget. If they cut our state budget, like I said, we will save some from, as mentioned before, we will save some funding because fulfillment will be recouped. Printing notices, part of fulfillment will be recouped at a higher percentage from the feds. So we'll save some funds there. But if they come in and say, hey, we're cutting they already cut us by $3 million. I don't see that happening. But I guess you never say never. But
Okay.
yeah.
you guys clarified something that, but I'm not sure my question, and maybe I didn't ask it clearly. In the past, it seems that the board has had to adjust NTEs. I'm not sure if it was for IT or what. So there has been times where staff has come back to us to change the NTE to increase it. And that's where I'm coming from.
Right.
Like when you came up with these numbers, I understand you guys went through a fantastic process, checks and balances. I have full trust in the staff in doing that. But in the past, we've been asked to approve increased NTEs. And that's where I guess my question lies is, will we have to come back and approve decreased NTEs because of a reduction of funding? And do you have a plan B?
Well,
C?
maybe I can take that, Dana. An NTE is a not to exceed, so we don't have to do it if we can always spend less if circumstances warranted it. So that would be the NTE is the high bar. So we can always spend less. We don't have to go back to lower it. The times we have come to increase it is because of things like COVID or the unwinding or things that have come, that we weren't
Unexpected.
prepared for, that required code changes and stuff like that. So there would be no need to come back because we're not on the hook for everything in an NTE. That just happens to be the high bar.
Yeah, and one thing I can add too is the NTE increase that we've asked for in the past, the NTE for a individual task order, for individual task orders, always in each those years, they reduced other task orders so that we totally stayed under the total NTE of the 35 million. So the only way we've increased the NTE of 35 million is if we had an initiative from the federal government that says, hey, you're going to have to do this, like no wrong door. And so we required additional resources to accomplish that. So that's why we came back and asked for additional funding overall for IDIQ. But typically when we're asking for a task order increase, that's not going to increase this 35,475,000 because somebody else will get less hours. Is it?
Okay. Maybe I was overthinking of it because of the Key Bridge collapse, which none of us really predicted. So had you not had in there subject to the availability of federal and state funds, I probably wouldn't even thought of it, but it's good that it's there.
It's a great question. It really was, because all the time I think about that and say, okay, what happens, if this happened? I do, and I'm sure we all do as a collective unit think about that.
I'm sure you do. Thank you.
Chair, if I may. So I'm still,
Go ahead.
I'm still, not with you, Anthony, Tony. When we were again reviewing this request, the 4 resources that were being added, we were advised were for a short period of time. And if we know that something is for a short period of time, I don't feel comfortable committing ourselves for a minimum of 3 years plus 2 years, renewal potentially. So if it's something is needed for a few months, short term, whatever that is defined, is clearly not 3 years. And the second is, we would also advise that there'll be additional saving because of the way some restructure is happening at the lower level of, and that there will be 4 resource savings, at least 4 resources, sometimes by the end of the year. So with those factors playing in, committing ourselves to 155 resources, if we know that several of those resources, 4 plus some of the part-timers, will not be needed, gives me uncomfort approving them for the full fiscal year.
Well, just as a point of clarification, I haven't heard anyone say you're committing these temporary resources for 3 years. Is that right, Venkat?
That is correct. We are not, this is a temporary position. My expectation is, Mr. Stefan, this would probably we would need until the end of the year. And then we would term these task orders for these for 4 or more resources. That's the plan.
But that's
in
not what
term-
the contract says. Contract is 3 years plus 2.
The umbrella, I think the umbrella IDIQ was for 3 to 5 years. The task orders within the IDIQ, some of them can be temporary, as Venkat has described.
Oh, that is not true because I reviewed those IDIQ contracts. They state minimum of 3 years plus 2 additional potentially. That's what each contract says.
I would, I mean, again, like I said, the contract structuring is unfortunately beyond me, but I would, but I also know that IDIQ option gives the agency to end the contract, just like we showed even in one of the slides. We had to end one position, so we ended, even though the position was committed for 5 years, we ended within a year. So that is how this structure operates. So the agency has the leeway to terminate the task order at will as the business dictates. I mean, right now that's the structure and that's what we are following.
So this is any particular resource is not committed to 3 years. Is that right, Venkat? You have the option for any particular resource to use that resource as long as they're needed for development or other IT activities. The umbrella contract is for 3 years with two option years. But that doesn't guarantee any individual under that contract from 3 years or 5 years or even 5 months of employment if they're not needed.
That is correct, Mr. Shah. And this applies to all the 158 contractors, not just these 4. It applies to all of the contractors that who can be terminated by the exchange as per the contract, master contract at any time based on our need.
Well, if I may, sir, my understanding is looking at these contracts, it's based upon budget availability, not based upon need. And I would like to hear that from our council or our procurement manager, what their understanding is.
I'm sorry, Sam, can you repeat your question?
What I'm hearing is that we can terminate any contract based upon need, not based upon necessarily the budget availability. That if we, these 4 contracts that we signed, for example, they said they're for 3 years or the remaining term of the master contract. So 3 years or part of 3 years plus 2 option years. That if we decide after 6 months that we do not need one of those individuals based upon our need, not fund availability issue, but based on our need, that we can terminate that contract without any penalty of any kind.
That is correct. The state does have a clause on contract on, I think it's 17 and 18. 17 will state that the state can terminate a contract for cause, and then 18 is the state can terminate as needed. So
That's
one
right.
is if an employee is not doing what he's supposed to do, obviously we can terminate. And in addition, we can also terminate if we don't have the need for the person any longer.
The actual buzzword there is for convenience.
Convenience, thank you.
Okay, thank you. Thank you for clarifying. And of course, there's one for the budget, that if the state doesn't have the budget, then state can terminate based upon unavailability of funds. That,
Yes, sir.
Well, that would be for convenience, as
Right.
Tony stated. Yes, correct.
okay,
Any other questions?
no, I don't. Thank you.
So
Thank you.
I have a
Oh.
motion, I have a motion. I move to approve a total not to exceed amount of $35,475,000 with the federal government's financial participation amount of $25,687,877 and $200 and state participation of $9,787,800 for the ITIQ contracts for FY 25, subject to the availability of federal and state funds as presented. Do I have a second? Board Member Kester is second. All those in favor?
I can't see Maria and Laura, sorry.
I don't see Lauren.
Oh, I see Maria. I don't see Laura. Is Laura Crandon still here? If not, we can't vote.
She's here. She's on. But she's muted. There you
I
go.
am, yes.
Do you have, I
Sorry.
can't see you. Do you have your hand raised?
Laura, do you vote aye?
Oh, yeah, sorry.
Okay, I see you. Thank you.
All right,
It's unanimous.
Thank you, everyone.
thank you.
Sure, Ben.
Thank you very much, everyone. Let's move to the next agenda item, which is the actuarial services contract. Tracy, Gamble, and Johanna. Go ahead. Johanna, you're gonna provide an overview.
Yes, thank
Please
you.
proceed.
Thank you. Yeah, Tracy is here if there are any questions for procurement, but otherwise I'll run through the presentation. Next slide. So as you are aware, we contract with the consulting firm Lewis and Ellis for actuarial services, including modeling for our reinsurance program and our now upcoming 1332 waiver amendment pursuant to the Access to Care Act to allow all Maryland residents to enroll on exchange regardless of their immigration status. They also support our various affordability programs. So that includes the young adult subsidy and our value plans. So they assist us with modeling related to those initiatives. And then generally kind of ad hoc other support, actuarial support is requested. We are currently in their first option year and asking the board in this presentation to approve execution of the second option year, which would be for the period July 1, 2024 through June 30th, 2025, with an NTE of $200,000 for the contract year. Next slide. So just some highlights of the work that they've done for the exchange over FY 2024. Excuse me. They did extensive modeling to support two significant legislative reports that we collaborated with other agencies to submit. The House Bill 413 report, which we worked with MIA and MHCC on, and provided recommendations regarding the future of the reinsurance program, and then also modeling of other potential affordability programs that state could consider in the future, including expansion of a state premium or a state cost sharing wrap. And then the Senate Bill 806 legislative report, which was a report in collaboration with the Department of Health on the potential impact and cost of allowing all residents, regardless of immigration status, to enroll in Medicaid using state-only dollars and to enroll through the exchange. So that was quite a lot of work. They did a great job helping us with that. As I mentioned, they're also at work now on modeling to be included in our waiver amendment application. During the last year, they worked on both analysis to inform the board's decision to set plan year 2024 reinsurance parameters, and they're currently working on analysis to support recommendations for 2025 parameters. They also provided actuarial modeling to help us make updates to our 2025 value plan designs. And they worked extensively with us earlier in the year on projecting young adult subsidy annual costs and modeling for both this year and to inform the board's setting of parameters for next year. So we definitely keep them busy. Next slide. And so with that, I'm happy to take any questions.
Any questions for Johanna? Laura? No.
Yes.
Okay.
The firm, is there a policy around separation of duties in case this firm also works for any of the carriers?
Yes, I'd have to refresh my memory on that, but that was included in the RFP initially when we created the contract with them, that that separation had to be in place so there would be no conflict.
Other questions? So I had one, Johanna, for the previous two contract periods, did they exhaust all the funds?
I think they came close, but did not, they didn't fully exhaust the NTE.
Right. Thank you. Any other questions? So I move to approve exercising the second year of the actuarial services contract with Lewis and Ellis from July 1, 2024 to June 30th, 2025 for a not to exceed amount of $200,000. Do I have a second?
Second,
Board Member Tanisha seconds. All those in favor?
aye.
It's unanimous.
Okay, thank you. It's unanimous.
So we have no closed meeting today. So wait a minute. Dana has a question. She's raised her hand. Go ahead. Oh, no, she's just voting. Okay, we have no closed meeting today. So with that, first off, thank you everyone for your attention and questions and participation in the meeting. Staff, great job as usual. Do I have a motion to adjourn?
So moved.
Second. I'll second, or Dana seconds. So with that, thank you all. Do we have a meeting scheduled for June? I'm not quite, we have a regular meeting scheduled for June.
Yes, we have, it's our annual meeting will be June 17th now, not the full day retreat. And this is also a mandatory in person since it's our annual, and it will be at MHCC. And if I haven't, I will update the calendar invite. Thank you.
Yes, the beautiful world headquarters of the Maryland Healthcare Commission will host the meeting. So look forward to seeing you all in person. Thank you very much and have a good afternoon.
Thank you and good job, Ben. Thank you.